Good morning, everybody. If you can just bear with us a couple of seconds while we wait for everybody to join. My name is Les Jones. I'm joined by Rebecca Dunstall, our clinical lead. We're just going to wait a couple more seconds just for people to join us. Okay, if we start this morning's webinar, our September webinar, the months are flying by, is back to basics. It's back to school, it's back to basics. 10 things you need to know about specialist seating. It's to do with specialist seating in the real world. We're not so clinical this morning. It's tips on, top 10 tips, if you like, on what makes specialist seating effective for your client, service user, client, customer. Before we start, before I hand you over to Rebecca, just a little bit of housekeeping. We should have switched off cameras and mics. We are recording the session. If you have any technical issues, we've got our colleague Jess in the background. If you want to post the issue, and Jess will try to resolve that. But what we tend to find works best is just to leave the meeting and return to the meeting. It tends to reconfigure settings and allows you to join us. After the session this morning, we will send you a copy of the presentation. If I just leave Rebecca to load her presentation. So the first section of the session this morning will be a PowerPoint presentation. Then we'll come back to do a little bit of hands-on with the seating we have here in the room. We're hoping to have plenty of time as well at the end to take some questions and hopefully some answers for those questions as well. So without any further ado, I'll hand you over to Rebecca.
Thank you, Les. Let's get the presentation up. Lovely. So as Les said, there's going to be a bit of a PowerPoint presentation now with myself, and then we'll follow that up with a bit of practical with the chairs, with some of the seating solutions, and really trying to put some of that theory that we've learned into practice and how we can use the chairs to enhance the lives of the individuals that we work with. This is a back to basics, and it's really our top 10 hints and tips for effective provision, how to make specialist seating work in real life. It's not really about the assessment or the prescription process. We've covered that on previous webinars. So if anyone wants the links to those or any of the videos that we have already recorded, we can share those. That goes into more detail about the actual assessment and some of the postural challenges and seating solutions. This is really about stripping it back. That how do we make seating work in real life? And I think first of all, we need to just quickly recap what we mean by specialist seating. It is critical to an individual's quality of life when a person's ability to achieve supportive, protective postures is affected, whether that's through illness, age, disability or disease. It can have a significant impact on their health and well-being. Our last webinar back in July was actually on really the clinical justifications for specialist seating. So again, if anyone wants a link to that, we covered some case studies about the impact that seating can have on health and well-being. So please do ask Jess in the chat section if you wanted a link to that. But in the simplest of terms, specialist seating aims to allow individuals who might otherwise have difficulty to achieve their optimum sitting posture. And the key word there is optimum. As we work through this presentation, you'll find one of our last points that we want to end on is around this achieving optimum posture and compromising sometimes on accommodating and correcting. So we'll go into that in a bit more detail shortly. Now, the good thing about specialist seating is that it offers high levels of comfort and support. There's adjustability and flexibility with a range of functions and accessories that are available. The ability to adjust both left and right sides if that's needed of seating systems, if there's any asymmetrical postures. Pressure redistributing technology, so at CareFlex is our Waterfall technology, and maybe we'll have some time if we go through the question answers to cover that later. But that working in conjunction with functions like tilting space and back angle recline if it's appropriate can help manage pressure injury risk. A choice of fabrics and colours that can have different impacts on different individuals in different ways. Specialist seating is always designed and engineered with the support network in mind. And again, we can touch on that in a little while. And then with CareFlex as well, making sure that we offer that exceptional service from the moment you contact CareFlex, through the assessment, through the prescription, and even then into the setup and aftercare support. And again, I think Les is probably going to touch on that later when we actually look at the chairs in a bit more detail. Now, the first point I wanted to cover, and really a key point that will make specialist seating work in the real world, is making sure that we have a holistic approach. So it's the definition of holistic is that it's the treatment of the whole person that will take into account the mental and social factors rather than just those symptoms of the disease or the condition or the particular diagnosis. This holistic approach is what ensures person-centered care. So it's not a narrow focus on the diagnosis, but actually the consideration of all the person's well-being and how they're presented in front of us. If we determine this key information about the individual and the support network, and as I said, we'll touch on that in a bit shortly, we can aim to achieve this correct, safe, consistent compliance, and that's how we achieve our clinical objectives. If the individual or the support network are not competent or confident in using a piece of equipment, then we're just simply not going to achieve those clinical benefits, and the chair will just sit in the corner of the room gathering dust, sadly. So I said about the support network, they need to be involved throughout the whole process, the assessment, selection, issue and review where it's indicated, especially maybe if we're working with individuals who present with complex presentations. We'll often be relying on the support network, whether that's family, loved ones, friends, hospital settings, care home settings. We will be relying heavily on them to be able to utilise the specialist seating system, even down to actually transferring individuals into and out of the chair. So we have to aim to reduce that dependency. We've got to reduce that carer effort whilst always ensuring safety for all parties involved. Equipment that's compatible with daily life will give us that compliance with the care plan. So the second point we have is, what does daily life look like for an individual? We need to understand an individual's daily life throughout the full 24 hours. Now, I know we're focusing on specialist seating today, but those of you who have an interest in postural care will know how important it is that we also address that full 24 hours. Where does that chair fit into the individual's routine? What does the chair need to offer? And how will the chair integrate into the environment, into daily life, into all the other equipment that they use, and into their care plan? This 24-hour postural care programme, again, obviously we'll be sharing this presentation so you can have access to all the references, but especially when we're doing our clinical justifications, making sure that we have that evidence base to be able to justify our interventions. This is a really good one that actually says that we, as part of the individualised 24-hour postural care approach, that there's the provision of seating, positioning equipment to support the person in lie-in. That's not just at night time, but at any point that they're in lie-in positions. It includes the moving and handling techniques, and we'll cover this a bit later, but that the initial setup of the chair, the initial positioning within the chair and how it's used is actually a really, really key detail. The chair will only be as good as how the person is positioned within it. And then that includes advice and training as well for the individual or the support network across all settings. And again, if there are any training needs, please do message Jess. I believe we've got a dedicated email address as well if you wanted to send in your training needs, and that's something we can discuss. This 24-hour postural care approach is something that aims to preserve or even restore, hopefully, body shape for individuals with movement difficulties. Now, it's worth remembering that body distortion is not inevitable, and with the right equipment and the right positioning techniques, we can help to protect an individual's body shape. It's essentially the holistic use of any technique to minimise that postural abnormality whilst enhancing functional movement. And that's the key part there of an individual's well-being and quality of life. If we don't protect body shape, there are going to be physical, psychological and emotional effects of body shape distortion, which will sadly lead to severe and life-threatening consequences. I'm a physiotherapist by background, and I was fortunate when I graduated, I specialised straight away into learning disabilities. So that's where my passion for postural care or specialist seating comes from. And when you start looking at the research and the facts and figures, it can actually be quite shocking. It's believed that 52% of individuals with a learning disability die prematurely from respiratory related conditions. And as we know, posture can have a significant impact on physiological function. So we need to make sure that we are protecting body shape. Now, we have to make sure that we are proactive with this postural care. So when it comes to seating, obviously the simpler the seating solution, the simpler the prescription, and the simpler it is for care plans to be followed. So what we want to do is identify risk and get equipment in place in a timely manner, implementing those interventions as early as possible. As I said, it's not inevitable. Body distortion isn't inevitable. So we need to put those solutions in place, like specialist seating, to reduce the risk of secondary complications happening that sadly can become irreversible. It's a lot easier to seat individuals who still have range of movement at the hips and knees, for example, than somebody who has been confined to bed for a period of time and has sadly developed contractures. So we've got to think holistically. Again, all these symptoms are going to interlink, but we have to think holistically to identify those at risk of achieving good or protective postures. Now, there's 3 areas here that we like to focus on when we try and identify individuals at risk. Those who lack the physical ability to change position themselves, those who maybe have cognitive impairments, who don't know or don't understand that they need to change position themselves, and then those with communication difficulties who might not be able to tell people or relay that information that they're uncomfortable and need to change position. So it's not just thinking about those who have limited movement, but actually the cognitive and communication factors as well. So identify those, utilise resources, and determine that need for specific postural care pathways. This moves us on. When we think about daily life for individual, a big part of that is the environment. So the third thing we're going to cover is the environment and enabling individuals to be able to interact with their environment. The ergonomics of the chair should ensure safety and ease of use as well for the support network. So, for example, individuals who reside at home with family, that might be a big part of their day, being able to manoeuvre around the rooms, to be able to do different activities from the bedroom to the kitchen to the lounge. So we need to make sure that that chair integrates with the environment. We need to make sure things like space, for tilting space to be able to be utilised effectively, that it's not causing any hazard or banging into walls or hitting any of the equipment. I think Les has got a good anecdote about the environment, about an individual in a care home, wasn't it, Les?
Yeah, it was the position of the TV that made the difference.
Mm-hmm.
You know, it was his focal point was the TV, and he was having to reposition himself to look at the TV, and just simply repositioning the TV made the difference to his posture, which he wouldn't have necessarily have associated with him initially. Yeah,
the position of window to somebody likes to bird watch or look out the window and look at the view, or people watch, and it's seeing if that's a key part of their day, then the chair needs to fit into that, so they're not having to rotate the head or rotate the pelvis, and because then we could have a whole host of other problems, and the posture could be worse than when we first got involved. And I guess another part of that as well is the actual logistics layers of going to assessments. And those of you who do get in contact with CareFlex, and you might speak to Jess on the phone, some of the questions that she will be asking is actually gravel pathways,
the
doorways.
To the specialist seating advisor, gravel driveway.
Yeah. We want to maximise assessments with you. Our seating assessors want to get the most out of the assessment. So if we can limit any of those obstacles and get the most out of the assessment on the day, that's inevitably going to help in the long term and getting the right seating prescription in place in a timely manner. Another part of this is the aesthetics. Now, is this important or is it a luxury? Now, aesthetics could actually be key to compliance. I may be speaking to individuals now who maybe work with loan stores where black or brown or grey is now the go-to colours, but there is a place here to consider the aesthetics of the chair and how that impacts on compliance, especially if you work with individuals with on the autism spectrum, or maybe those with dementia, that familiarity with certain colours or an affinity to, as you can see in the image there, a particular football team, and trying to match up their likes and dislikes with a piece of equipment. It's the same as what we do in our home, really, with our sofa. You would have something that matches your environment and what you feel comfortable sitting in. So actually, sometimes it is really key to that compliance, and we are able to critically and clinically justify that as part of our requests or as part of our evidence base for that. And I think Les, again, will probably touch upon the aesthetics when we have a look at the chairs in a bit more detail now. We have got the standard range of fabrics, but we've done all sorts in the past with people's football kits, and especially with children, paediatrics as well. Yeah,
gentlemen, there's a Liverpool supporter, I believe, and we can accommodate most requirements.
It is okay to sometimes consider the aesthetics of something, even down to maybe the certain textures or certain fabrics if somebody has sensory impairments as well, and just thinking that outside of the box, actually, how are we going to make sure that this individual is compliant with the specialist seating system? Thinking about things like, do they have a particular sensitivity to firm surfaces? Do they then need a softer foot cushion to encompass their feet, or do they need a firm foot plate so they got that proprioceptive feedback? It's just thinking about all elements of that individual, not just the physical, but the cognitive, the communication, the sensory, and everything else to really make that specialist seating work in real life for them. The fifth point we want to cover is the chair measurements. Now, this is fundamental to safe and effective provision, and it's probably one of the most basic steps that sometimes is overlooked, I feel. If you are getting referrals through, or if you're getting phone calls from support networks that a chair doesn't seem to be working anymore, then before you have a look at that postural review, just check the chair dimensions, how the chair is set up. It's really important that seat depth, seat width, matches the individual's body shape and size. Every chair must be set up to fit its user, because if it's not, it can actually cause more harm than good. For example, I don't have any damage to my body systems. I have good range of movement in my hips and knees, flexibility in my spine and pelvis. But if I was to go to a restaurant where the seat depth was too long for me, I don't have the longest of legs. To be able to get my feet on the floor, I would have to go into sacral sitting just to get my feet on the floor and get that stability. And suddenly now I've created this postural challenge without any reason for doing so. So take it a step back, always look at the chair measurements. And again, Les will just show you how easy it is to look at things like adjustability, seat depth and seat width, and having the confidence to be able to do that with individuals. That adjustability is what's critical for the postural stability, but also the pressure distribution as well. In the simplest of terms, we want to get as much of the individual in contact with the chair as possible. Now, I'm sure most people know this, but the pelvis is the foundation. It's what enables individuals to achieve protective, supported sitting postures, because it dictates what happens to the body segment above and below. It's positioned at our core, and it acts as this support system for the entire body. So what the pelvis does, you will see an impact then on the trunk and head and the lower limbs down to the feet. We should be stabilizing it in all planes of movement. So that's thinking about the tilt, the rotation, and the obliquity as well. And the aim is to the gold standard, the optimum would be to correct the pelvis if it can be corrected. But remember, there is a fine balance here, and if individuals have complex fixed postures, then we may need to accommodate them. So if we're not correcting, we still have to accommodate to reduce the risk of further deterioration from happening. Now, the pelvis is so important because, as I said, it dictates what happens to the trunk. Now, a major goal in postural care is to promote good health and enhance our autonomic nervous system function. The inability to sit upright can result in a decline in overall health, and we will see this reflected in a person's physiological function. So trunk asymmetry and poor head position can impair a person's respiration, cardiac efficiency, they swallow function, digestion, and then consequently they're going to be at risk of an increased risk, especially if they already have dysphagia, for example. We could be putting them at risk of aspiration from when they're eating and drinking, or maybe from not being able to control their saliva. Infection that could come from this, respiratory infections and distress, and then related hospital admissions. This is about a person's health. We have to get them sitting as upright as possible to enhance their physiological functions and protect their body structures, but also their internal organs as well. Now, specialist seating systems play a role here because they can support breathing, they can support circulation. I mean, it seems self-explanatory, but sitting upright with a good head position can facilitate a normal swallow pattern to help with eating and drinking and different components of eating and drinking. So we get the pelvic stability to have this impact on the trunk and the head. And again, when we look at the chairs, there are different seating solutions that can help with that, with pelvic stability, with lateral support to give feedback for the trunk, but then also support the head as well. Number 7, we have critical angles for sitting. Now, as part of the assessment, this is a really key process to gather this information before coming to the seating assessment. So if you got in contact with CareFlex, or if you know your local CareFlex seating assessor, then they would need to know this information to know what kind of chair and functions and accessories to bring out. It's really essential that they know an individual's hip range of movement and knee range of movement, if there's any restrictions with that, because it will dictate if somebody needs, for example, back angle recline, or whether somebody needs a negative angle leg rest. Things like wind sweeping as well. Do the seating assessors need to consider bringing out a pommel or a contoured cushion to be able to try and correct or accommodate certain fixed postural challenges. Number 8, we have over-prescribing is actually a very real possibility. This is really about safety as well as ease of use for the individual and their support network. Not all functions and accessories are suitable for all users. As we go through the chairs shortly, so you can actually see some of the seating solutions in action and how specialist seating can integrate into daily life. I'll probably butt in, Les, and just talk about actually some of the precautions and things and contraindications for things like tilt in space and back angle recline. But I think it makes more sense if you actually visually see those functions in action. Because we do have to apply some of these precautions to some individuals to make sure that they're safe within the seating system. The simpler the prescription, the easier it is going to implement. Now, number 9, I was considering putting this as number 1 because we always say it's our top priority here at CareFlex. Comfort is key for quality of life. But I kept rejigging all these numbers and couldn't decide which of these number 10 was the most important. But comfort is essential for quality of life. We need to make sure that we are putting seating systems in place that promote comfort and feelings of safety within the chair, because this is what will enhance daily life. But it also increase that individual's tolerance of the seating position and hopefully compliance with a piece of equipment. Now, research has shown that regardless of the clinical benefits that we are trying to sell to individuals and get across that actually how important it is, if they are not comfortable within the chair, then they are simply not going to use it. Comfort is entirely subjective. So in order to achieve this, we've got to involve them. We've got to understand how they communicate that comfort, especially if someone's non-verbal. How would we understand whether that individual is comfortable within the chair to make sure that they're compliant with using it? They are going to be at the centre, and we need to show that those views are respected, because essentially that's how we get our clinical objectives met as well. Lack of postural care causes tension on the body. So when we mentioned about specialist seating prescriptions and getting these solutions in place, it's about getting, as much as we said, getting as much of the individual in contact with the chair as possible, but also protecting those body segments, making sure that the right back style, for example, is suitable to that individual's comfort levels. It's the same with any individual, any member of the general population. We've all got different ideas of whether we prefer firm support or softer support. So we've got to involve them. We've got to understand how they communicate that and involve the support work if we need to, support network if we need to understand if, yeah, they are comfortable, and the overall aim is to get them compliant and consistent with that piece of equipment. And then finally, we just wanted to say that it is okay in certain situations to compromise. Now, a gold standard 90-90-90 posture, as you know, is often not achievable in real life. And if we put the videos on now, I'm pretty sure that not many people right now will be sitting in this gold standard perfect posture. So when we work with individuals who already have complex postures, striving for this perfection can be detrimental to that holistic approach. If we only focus on that perfect posture, we could be then impact on all other aspects of daily life. Just as a side story really that always sticks in my mind now and just reiterates this for me, when I remember being a newly qualified physio and was heavily on the physical presentation at the time, working with a lady who had a hemiplegia. And I went out to assess and could see, this was in her wheelchair, I could see that she was rotated at the pelvis, rotated at the trunk, wasn't using the foot plate, and suddenly in my head I was just focusing on trying to get that perfect posture. She was correctable, so we'd get the foot plate in place and get the pelvis supported and stabilised at the back of the wheelchair. Then went out a few weeks later to review and hated that. She hated that setup and probably hated me at that point as well, because actually what I should have found out was how she used that chair within daily life, and she used to use her unaffected side to scoot, and because she was non-ambulant, but to scoot around the environment, and I took that skill away from her. So it can often be detrimental to strive for that perfect position, which is why we like to say we have the optimum position for that individual whilst considering their holistic needs. And we appreciate it's that fine balance between correcting and accommodating, but we are here, and our seating assessors are here to guide you through that process when you have the seating assessment, that joint collaboration to come up with a perfect seating solution that's the optimum position for the individual. I just really wanted to cover that because I think it's something that maybe setting expectations is what's key here, and what's actually achievable in real life. We might work with individuals, for example, who have a new diagnosis where medical equipment is a new thing to them. Do we need to set those expectations beforehand by showing them videos or showing them photos before going out? And then all those other points link into this, finding out what they want from the chair. Are aesthetics important? Do we need to ask the support network about being able to manoeuvre or change or set up the chair? So just to recap our 10 hints and tips then. Number one, always ensure a holistic approach and involve the support network where necessary. Consider the individual's daily life to ensure that the chair integrates seamlessly for consistent use. The environment will dictate the effectiveness, so especially how the chair is positioned and used with other pieces of equipment, especially with things like moving and handling. The aesthetics could actually be key to compliance for those with who might be on the autism spectrum with dementia or sensory impairments. The correct chair measurements and setup is fundamental to safe and effective provision. Remember that the pelvis is the foundation and will dictate what happens to the body segments above and below. So it's always the best starting point to work our way then through the other body segments, making sure that we first have that postural stability. The prescription will need to address the critical angles for sitting to ensure there's the correct setup and utilization for the individual. So if somebody has limited knee range of movement, if they have short hamstring muscles or contractures at the knee, then we need to be making sure as part of the handover, as part of the care plan, that the individual and their support network know not to use the leg rest elevation, for example. Do we need to laminate photos or care plans or timetables and make it really clear how to utilize the chair safely? Over prescribing is a very real possibility that needs to be avoided. So always go for the least restrictive option and make sure that everyone involved is comfortable and competent with using that. Comfort is a top priority as it's key to compliance and consistent use. And remember, at times it is acceptable to compromise if the prescription is the optimum for the individual. I just wanted to finish really with touching on the human cost of making sure that we have good postural care and effective seating provision. If we promote comfort, if we manage fatigue levels, if we have that postural support for physiological function, then an individual's care or their journey of recovery following a traumatic health event is going to be protected. So we have to protect that body shape, get that stability for functional movement, because this is what's key to health and well-being as well. But we also can't underestimate the importance of psychosocial factors on overall quality of life. If an individual doesn't have equipment that protects their body shape, doesn't give them protective seating positions, then it can result in them being confined to the four walls of their bedroom with limited interaction and engagement. And it's actually quite shocking. The research has shown that loneliness and social isolation are twice as harmful as obesity to physical and mental health. So we have to think holistically, sometimes outside of the box, to make sure that chair fits into daily life. And I think we'll probably cover this later as well, some of the resources that are available. This is a very broad topic, and we've obviously highlighted the really basic hints and tips, but if you wanted more in-depth information on specialist seating, then we've got a wealth of stuff on the website, or we can send resources out as well. If you needed to know about the clinical evaluations or real-life case studies, and even clinical justifications as well to go along with each of our chairs, then we are on hand for that. Okay, so let's get us back on screen. Hopefully everyone can see Les.
Okay, so what I thought I would do now is just have a look at our seating and highlight some of the 10 points that Rebecca's been talking about this morning. I'm going to start with something I tend to finish with, but I think I'd move things around just to place an emphasis on this subject, and that's the aesthetic of the chair. As you can see from the chairs I have with me today, one chair stands out more than the others. Yeah, our bright orange Smart Seat Pro 2. The aesthetic can be a key consideration for the person using the chair. It's often considered to be a luxury, but the colour can make the difference. As we saw in Rebecca's presentation, the gentleman there in I think it was a Liverpool.
Yeah,
it was Liverpool. Yeah, got to get that right. In the red, and that made a big difference. It wasn't a postural consideration, but it was really did help with compliance, and it was a key thing. And just to say as well, with seating, specialist seating, you have a second chance. So if you are providing the bright orange chair for somebody because they wanted the bright orange fabric and it kind of matched in with a modern, vibrant home setting, that chair can come back in and be reissued. We can change the covers. All the chairs with us, or all the chairs within the range, are loose cover chairs. So we can change the fabric if need be. We can change the colour. The other consideration, which with the aesthetic as well, sometimes If I'm working with a customer who's had a really rapid onset of some kind of neurological condition, my first part of the visit will be to visit with the product guide and to show pictures of the product rather than just wheel this chair in, because as much as I love my chairs, I can't say hand on heart they're the best looking chairs in the world.
If somebody's not used to medical equipment, that's what they are.
Yeah.
And I think it's stepping away. It's not a comfy chair, which historically they've been known as. It is a comfortable chair.
Yeah.
But this term comfy chair is actually a medical device.
Yeah,
it's a prescription. This is important to somebody's medication because we have to protect the individual's body structure and body shape.
It's as Rebecca said, it's a medical device, and the function becomes before the aesthetic, and it's got to do what it says on the tin. The other thing to consider is powered and motorized options on the chairs. Again, sometimes seen as a luxury, but we talked about integration. The chairs can be integrated, the power chair can be integrated into an environmental control system. So it gives that person a little bit more independence, can help with the number of care calls during a day as well. If somebody can reposition themselves in the chair, it just gives somebody a little bit of ownership with their current situation. So moving on then, I think Rebecca, we toyed with which came first and which came second and which came third in the top 10. But comfort, I think we'd say would always be at the very least in the top 3. And I'll kind of illustrate that with the Multijust chair, and we'll talk a little bit about the Hydro Tilt. The Multijust is a tilt in space with back angle recline, elevating leg rest, built-in seat width, and arm height adjustment. Now, I'm going to focus on perhaps postural support in terms of trying to keep somebody in a midline, somebody with a poor sitting balance. So initially, we may well consider good old-fashioned adjustable lateral, which can be moved up and down, in and out, very adjustable. The one issue is sometimes, perhaps with an elderly client, frail and elderly, with skin integrity issues and perhaps not a full range of movement at the shoulder and the arm, it can be difficult to get that lateral in. Yeah. So we need to, that word again, compromise. We need to think of an alternative way in which we can provide that lateral support for somebody. So I would then look to move towards more of a prompt for lateral support.
Just quickly, we said about things like back angle recline, tilt in space, and saying that they're not appropriate for everyone. We've got to use them responsibly and think about certain precautions. I think laterals is one of those things, especially with back angle recline, we have to be very, very mindful of. If you have decided that somebody needs lateral support, maybe they need 3-point lateral support, or something like the SmartSeat Pro 2, where they need this multi-point lateral support because they have quite a complex spinal presentation, just think about back angle recline. Do they actually need that back angle recline function? Because what can happen, especially as Les said, with somebody who lacks postural control or sitting balance, we open up the hip angle for back angle recline. They'd obviously then get extended slightly into this position. If we then bring the back angle back to neutral, and they are unable to reposition themselves, we suddenly compress in, and what we can see then is actually an even more detrimental impact on their trunk, because suddenly everything is being compressed. The shoulder girdle is becoming rounded because they can't reposition, and those laterals are forcing them into that position. So just be mindful of that with back angle recline.
You know, in essence, we need that person to be able to reposition themselves, and more often than not, they don't have that ability. So coming back to the back, I've removed my adjustable laterals. The Multijust is a very simple chair to reconfigure. I'm going to pop off the flat back. Perhaps I'd consider contoured back, just shaped back, very comfortable, just to prompt that midline position. Pops in, and we'd see how that would work. Again, looking at comfort, the third option we have is a waterfall back. Pops in here, and we use that with a slightly different headrest. So we have the 3 tiers in the back of the chair. Now this works really well with perhaps somebody who has a kyphotic profile because they become absorbed in the padding. It's a very soft fiber-filled cell, 3 cells. We can then
and this comes down again. We said
open the
about
back and
comfort.
reconfigure.
Yeah, we said about comfort being subjective. Some people really love waterfall backs, other people it doesn't make them feel as stable. And then Les said as well about removing some of the wadding, especially if somebody who maybe has a kyphotic posture. Removing some of that wadding can just help encompass the apex of that thoracic spine, and not only for pressure distribution but for comfort as well.
Yeah, and my tip when you're considering a waterfall back is look at that lateral support. It's very, very comfortable, but does it offer enough lateral support to keep that person in the midline pass if they wander off to sleep or something? Will it provide that lateral support? So it is a balance, it's a compromise between the contoured back and the waterfall back. That's compromise for comfort. Similarly with the hydro tilt, again, an option. The contoured back, you can see there, very modular design, you can see the shape, and again that prompts that person sitting in the midline. The advantage of the hydro tilt is that we have these foam lozenges in the back of the chair, which we can move and reposition to make perhaps one side of the contour more prominent to help correct and help to bring somebody back into that midline position.
And I think a key thing as well with trunk support is really trying the least restrictive option first, because some people can accept all the support that's given, where in seating, obviously we want periods of comfort and relaxation, but we can use them as rehabilitation seating as well as seating solutions. So being able to just prompt while still encourage them to actively engage themselves to maybe relearn skills. So again, try least restrictive options and then build up to see actually what do they need to manage not only their alignment and their upright sitting, but fatigue as well. So somebody could fatigue quite quickly and need actually more support later on during the day. Another thing as well is, because Les is obviously showing you all the different back supports and how they move, being able to retrospectively change things as well as in rehab settings, not only adding support if somebody's condition deteriorates, but taking support away as well to encourage more active engagement.
We're just going to move into that section now with adjustability. So all of our seating is seat width and seat depth adjustment. On the Smart Seat Pro 2, we have back height adjustment as well. Each section moves independently, and I can show you how that works in a second. Basically, on the hydro tilt, the seat width, change the thickness of the arm that we use on the chair. It's called a saddle arm, and it just sits on the outer frame of the chair. We're trying to get a snug fit to prompt that person to sit into a midline position and to support that person.
And just a quick point on seat width as well, because we said about how important it is to get the dimensions right for the individual. It's not always or measure the hip width, and that's the seat width. If somebody has a fixed windsweep in it, for example, we might actually need to go for a wider chair to accommodate that windsweeping to protect the lower legs as well, and then maybe use infills too to support the pelvis better.
So with the new Multijust on the Smart Seat Pro 2, the seat width adjustment is built into the chair. You can, if need be, take that arm off completely. You can adjust the arm height for the individual as well.
And also for windsweeping, angling, so being able to do different from front to back and from left to right. So if somebody does have windsweeping, being able to actually angle the armrests to get full support along the thighs.
And kind of the chair we have with the most back support would be the Smart Seat Pro, but again we need to be careful about over prescribing here as well. It's the most complex chair within the range in terms of postural support. But one chair doesn't fit all. You know, we need to consider the simplest option to start with. We need to future-proof things, but I would always consider perhaps the hydrotilt initially, and then work our way through the range of chairs. So with the Pro, we've got a locking system on the back of the chair. If I release the lock, it allows me to increase the height of the back. I can accommodate. So perhaps I may be having somebody with a fixed posture, and again, that I need to accommodate, so I can offset back support. As Rebecca said, you know, the initial setup is as that person is at that moment in time, but the adjustability allows us to future-proof the chair as well. So we need to consider how that person's condition is going to progress. And a chair like the Pro with that multi-adjustable back gives you that maximum adjustability. Critical angles, for me as a seating assessor, the two really important ones for me are knees and hips. If we have an issue with contractures of the lower leg, we need to make sure that our chair has a negative angle leg rest, and all the chairs have negative angle leg rests. The hydrotilt is a -25, -25 and 30 on the SmartSeat Pro 2. So when I say 30, back in, and we do see people with severe contractures, and I'm thinking, you know, if I'm at 90, I'm back to 45 and it's fixed. The issue we have there, brakes on, is that to accommodate that person's contracture, we need to remove the leg rest. So everything with me today is an off-the-shelf standard component of a chair. Now we have the facility to make bespoke components, which we call tailored solutions. So a tailored solution, an example of a tailored solution for somebody with a fixed severe contracture would be this, what we call a swinging leg rest. So that would allow the person's leg to be accommodated basically underneath the seat.
We can chamfer cushions as well.
Again, isn't it? Yeah.
Yeah, we can chamfer cushions as well, so that we can reduce the pressure of the back of the knee as well, because obviously there's more of an acute angle there.
Angle at the hip is important because, for example, a chair like the hydrotilt is tilt in space only, very simple chair. Back angle recline comes in with a multi-adjust on the SmartSeat Pro 2. So if I know that my person is a fixed or doesn't have a full range at the hip, I need to accommodate that person's posture. Otherwise, I can sit somebody in a hydrotilt and they'll have this gap at the back because they can't achieve the 105 degrees angle that the hydrotilt prompts. What else, Rebecca? Pelvic stability.
Pelvic stability.
So again, seat width and seat depth adjustment. We've also got options for more contoured seating. So you can see here we have a ramped and contoured seat cushion. Really helpful to drop the pelvis into a little bit of a well to provide that security. Perhaps we'd use this with straps or harnesses, if I can find them.
Positioning aids is one of those subjects that we sometimes get the most questions on, but we just make it clear that there are safety device alerts for positioning aids. We put them onto all of our resources as well, so the link is on there, because everyone who not only provides them but uses them day to day have a responsibility to check them over before use. So you have to be very careful and risk assess before using positioning aids. But in certain cases, especially with individuals who maybe have limited pelvic stability, those with involuntary movements, we have good success with individuals with choreic movements, so like with Huntington's disease, with the groin harnesses. They do in fact play a role in making sure that somebody is able to stay safe and positioned protectively within the chair. And there are going to be, depending on where you are in the country, it does work differently, but there could be consent and capacity issues, but that's something that can certainly be clinically justified and addressed as a multidisciplinary team, or up in Scotland. I know it works differently with welfare guardians, but just to say that they, for postural reasons, sometimes they are critical to having that person safe within the chair.
Right, and what I have in my hands here is it's like a standard wheelchair 4-point pelvic strap, which we can fit to any of the chairs as well. So you've got the 2 points coming back, you've got the padded section just to sit there so it avoids any friction issues.
And they have to be fitted
third
securely.
and fourth straps lock the belt down and stop it from riding up, and lock the pelvis back into place. And as Rebecca was about to say, they need to be fitted firmly to work effectively.
Yeah, because if they're not fitted securely, then we could get issues with shear and friction as well, if there's room to manoeuvre in there. So again, it's thinking holistically, thinking about the whole body approach, if it's suitable for someone. And definitely in these cases, trial and monitoring is going to be key as well.
And then there's the groin harness as well, which sits. It's kind of loose fit this just to give us an idea of how that works. It's on the base of the chair, wraps around the back, then comes up between the groin and straps here and that, locks back into place. It's quite effective.
Again, has to be risk assessed,
Yes.
has to be monitored and handed over very carefully as well.
I think that's my top 10 really. Is there anything else from you, Rebecca?
No, I mean, I could keep talking.
You can keep talking. Perhaps we'll take some questions. We've got a little bit of time left.
Yes, so we have a question here saying, in a paediatric setting where the child would be expected to grow, is the family care provider given education, and is the chair provided adjustable to facilitate growth, or are there reviews carried out periodically?
Great question, and leads us like neat little segue into the service that we provide, as opposed to just talking about products. Every component of the question you just asked is vital. So yes, there is adjustability built into the chair. Yes, we would provide family members or carers with training. That's key. I can't emphasize enough how important the initial setup of a product is. It's a class 1 medical device, and it's a cliche that I've avoided for this webinar. The devil is in the detail. Yeah, I tried, I've lost the bet. But the devil is in the detail, and it's the final little adjustments and tweaks, if you like, to the final setup of the chair. That's really, really important. In the pediatric setting, we accept that there's review, and we'll accommodate that and we'll support that review process as well. Growth in the chair with a child, there's only so far we can grow a certain size chair, if you like. So typically, this is very, very typically, there are small versions of the Tilt and the Pro. A small version would be 12-ish, would you say?
Yeah.
In years, very typical growth. Anything kind of young adult, we'd be looking at a medium chair. I was working with a 12-year-old the other week, and he was taller and bigger than me. So it's a very broad brush when we give those sizes. Does that answer the question, Jess? Did I miss anything?
There are things as well, like with tailored solutions. So sometimes we do work with individuals, maybe someone who has a Down syndrome diagnosis, who maybe has a smaller torso, or maybe somebody we work with, like, as I said, with some very tall individuals with very long legs, or very tall individuals. And there are the different things that can be done, like adding sections or removing sections, like on the Smart Seat Pro, because it's on a column.
So on a smaller version of this chair, and sometimes on the medium chair, where we have somebody who, on the medium chair, perhaps an adult, frail elderly individual with osteoporosis, their head is actually down here. So what we can actually do is remove this section. It just slides off the back of the chair, and drop the head section down. So it gives a more appropriate head support for that individual. Likewise, with a child or an infant, we may start with the small chair with the back section removed. We would deliver and we'd set up that section as and when the child grows up through the chair.
That's great, thanks Les. Another question, a really good one. The Multijust seems to have everything. Why have other chairs?
I guess over prescribing. If you're not going to need the feature and it's not needed for future proofing something, kind of in layman's terms, there's the more features there are, the more things there are to go wrong. The simpler the solution, the more predictable, if you like, the way that it'll be used. It's easier for carers to use, which is key. Sometimes as part of the assessment process, we obviously have to focus on the individual sitting in the chair, but sometimes it's important to focus on the carer capability.
And how it's used, there's different objectives. Like the Multijust has been ultimately designed and engineered for multi-use environments, hence the name, the adjustability to be able to easily adjust it tool-free in between different users, where something like the SmartSeat Pro then would be very much for individual prescriptions, because you would be looking to set up the back for fixed postures and leave it that way until a review happens and having to change it up. There are then different functions like on the SmartSeat Pro where you wouldn't get on a Multijust, like I don't think we mentioned the tilted space gauge.
Oh no, I would mention that in a second. If we just, why not just go for this, the Pro? So I'm thinking of somebody like a Huntington's gentleman, semi-ambulant. We want to maintain function, so they transfer in. I'll put the brakes on. So the transfer in is very kind of gradual. Where you can imagine the stress that's going to put on a 4-section multi-adjustable back. Okay. Also, if you have a client who's quite active in the chair, you need to take that into consideration with the robustness of the product as well.
Mm-hmm.
Yeah,
so it's just going back to the whole over prescribing, especially something like back angle recline, because obviously the section needs to be different. With something like the tilted space where we haven't got back angle recline, the whole system then stays nice and robust. So again, depending on the need, depending on the setting, that's why you would differentiate between different chairs.
I'm going to try and be clever. We've got on the new chair, the Multijust, we have a tilting space gauge. I'm going to try and zoom in on that.
My favorite feature.
Just so I see it there, okay. So where, the actual angle is critical.
We said about back angle recline, but it's the same with tilting space as well. We have to be very careful with how it's used, especially with individuals who maybe have a catheter, for example. If we tilt the chair back too much, there could be issues with backflow. Individuals who have maybe pooling of saliva or dysphagia, and maybe they only tolerate certain positions. Maybe they have prescribed, they have input from speech and language therapy and actually need to be in certain angles. This gives us a prescriptive way as part of the care plan to say, yes, this is what we can tolerate, this is what's safe. And even marking it off on there if we need to with red markers or Tipex if that's what
the red zone.
Yeah.
Another question we had was, how can fixed pelvic obliquity be accommodated with these seating options?
There's a level of absorption in the cushion that would accommodate an obliquity, but if we're looking to perhaps correct my terminology here, we may need to use a third-party cushion. So we would look to use a more configurable cushion where we can move the cells around within the cushion. So we could be building up one side or dropping one side, or
we have used ramps as well.
Cushions,
so if it hasn't been too extreme, and if somebody doesn't need third party or contoured, then sometimes just ramping one side as well can help. Again, depending on whether you're correcting or accommodating, depending on which way that ramp goes. Thinking about pelvic, just because we're talking about the pelvis as well and obliquity, often you might see a rotation with that. might see you might see a rotation with that. So especially with something like the Smart Seat Pro, where you can actually use the back section as well to accommodate or correct any rotation, and then using ramps or contour cushions for that obliquity.
So you can see with the cushions on all the chairs, all the components actually are very modular. So if we needed to build up one side of this cushion, quite simply just padding one side there, if that's a simple solution. Or if we needed to use a third-party cushion, we take our cushion away, which is a pressure care cushion, by the way, but we would take our cushion away and supply what we call a docking cushion. And what the docking cushion does, it's like an interface between the third-party cushion and the chair. It ensures that the cushion doesn't slide around, doesn't move around, because on some more configurable cushions, the pressure care is quite localized and needs to sit underneath the ITs. So if the cushion moves on the chair, it loses the pressure points that it's looking to protect.
Yeah, it also affects the dimensions as well, because if you don't want to make sure there's obviously any gaps or anything for entrapment, or any issues for room to maneuver, you still want to be able to have that adjustability over the cushions. The docking cushion allows that to make sure it's still one whole seating system.
Thank you. And another question was, if we purchase a chair, say a Multijust for a client in a care home setting, is there assistance available for resetting the chair for another client when the initial client no longer requires use of that chair?
Yes. Ideally, we'd like to speak to that care home and perhaps that care home group and set up a system, because to be honest, what we couldn't be doing is calling every other week to change the chair. But we certainly could build in a form of service level agreement to accommodate that need. Mm-hmm. It's part of the service. You know, the chairs are modular in design and adjustable, and that needs to be supported by the technician input, if you like, or training so that people understand how to adjust the chair and how to get the most use and benefit out of the chair.
Yeah, we've also done like a clinic as well, where we've looked at a few chairs that have sadly gone on and been recycled with other individuals as well. So you can, so you're not having, as Les said, you can't just keep going out, but to have a set time or a set period to be able to do that.
Thank you. We had another question as well, asking whether we have a handling plan template that clinicians could use and modify for their clients.
We don't have anything to do with moving and handling, but we have done templates for timetables before for individuals. We've helped with care plans and handovers, so it's not specific to handling, because we obviously don't do moving and handling training, but we've done joint sessions with Silverley as well on that. But we've got lots of templates that we've done for lots of different individuals over the years. There probably is something, but it's not necessarily about the handling. It's just about the use of the chair.
And handling.
Yeah,
it's the chair focused.
Yeah.
But it's a key point, though. If we interpret the question correctly, the posture of somebody sitting in one of these chairs is only as good as the transfer into the chair. Yeah. So it is vital that issue needs to be addressed. Yeah.
And sometimes a photo can speak 1,000 words, as they say. If there is the option to have a photo of somebody set up in their optimum sitting position, that's somewhere in the room or on the chair. I know there's issues sometimes around GDPR and things like that these days, but if you can have a photo, even if the face is non-identifiable, that actually shows somebody set up in the chair, so that it's just a quick reference then for somebody who's doing the handling to say, yeah, that looks like that looks like that, the tilted space is on the right angle, and so on. So hopefully that's answered the question. It's not specific about handling, but just about chair use and timetables.
Thank you. Another question was, do all of our chairs have a back angle recline function?
No. The hydrotilt is has it gone here?
For the reasons you said.
Is tilted in space only.
It has to be robust, this chair. Yeah.
And I kind of look at that as a strength. I look at the simplicity of the hydrotilt as its strong point. Very strong, very robust, simple for carers to use, but deceptively adjustable. Obviously, if you need back angle recline, then it's not going to work.
I mean, they do give a bit of, the chairs aren't set up at 90 degrees anyway, so somebody does have some limitations to hip flexion. I think it's 108, yes, so it does give you 18 degrees anyway of opening up the hip angle if somebody does have limitations there. So there is some adjustability. We have as well opened up further by putting wedges behind if we need to open up the hip angle a bit more.
That's part of the pre-assessment process. We'd identify that. requirement, that postural requirement, and we would start with the Multijust, not the hydrotilt, if somebody needed back angle recline.
Thanks. And just to confirm, would the HydroFlex have a back angle recline?
HydroFlex is back angle recline. That's a fourth chair within the range that we just didn't have an opportunity to bring with us today. But yeah, that has tilted space, back angle recline, elevating leg rest. It's very similar to the Multijust.
Thank you. And lastly, do we have assessment guides for our chairs?
Yes, we do. Yeah, we're in the process. There's 2 chairs that are still waiting, but certainly the SmartSeat Pro 2, the Multijust, they've got assessment and prescription guides. It's kind of just like a performer with some tables to help you just select maybe what back support might be needed, what the seat depth has been measured as, so that when you're doing the order forms or when you're with the seating assessors, it'll just make sure that that handover is clear in terms of what solutions are needed. And it's got a list of the accessories on there while they're available, and as you can tick. It's like a pro forma, really, the guides through the assessment and prescription. Yeah,
we can send those out as part of the follow-up as well.
Yeah,
I mean, we've referred to the website, I think, on a few occasions.
We did, yeah.
All the documents you need are on that website. You just need to sign in and download it. So they're readily available. And as Rebecca said, nearly every chair now has a full suite of support
clinical justifications,
documents,
assessment guides, 2 left to do on that one. Yeah.
That's great, thank you. I think that's all of the questions we have, but if anyone does have any other questions, please email info@careflex.co.uk.
Well, that's a wrap.
Yeah, thank you. There's a lot of information to get through in an hour. So if there's anything you need, then please just send us an email and we can help guide you.
So if that's it, if there are no more questions, we look forward to meeting you in the medium to short-term future. Hopefully we may see some of you at the OT show.
Yeah.
Thanks for attending, and we'll catch you all soon. Thank you.
Thank you very much.
Thank you.
Bye-bye.
Bye-bye.
Bye-bye.